Medicare for All would have saved more than 500,000 lives over the course of the last 2 years. We compared age-specific elevated mortality risk for people without insurance compared to those with insurance for COVID-19 specifically and from all other causes of death overall. We wanted to understand why the US has a higher rate of COVID mortality than any other high-income country, even though we spend more than any other nation, both in terms of per capita costs and overall. We calculated that if our country had implemented Medicare for All prior to the emergence of the pandemic, more than 338,000 deaths from COVID alone would have been averted. And that's on top of the more than 160,000 lives that universal health care would have saved our country from other causes of COVID over the last 2 years.
It is an absolute disgrace that right now, 30% of Americans today delay going to a doctor or going to a hospital because they can't afford the bill.
So people who don't have insurance usually don't have a primary care doctor and are more likely to suffer from preventable diseases like diabetes. And such comorbidities exacerbate risks of COVID-19 mortality. People without insurance also tend to wait longer to seek treatment, which further compounds death and transmission rates. Surveys also confirm that most of the country does want universal health care, so it's not a question of the public being persuaded.
The question is a very simple one. Do you have a health care system whose primary function is to prevent disease, whose primary function is to provide quality care to all the people in the most cost-effective way? Is that where we go? Or is the function of the health care system to make billions of dollars in profits for the owners of large insurance companies? That's what the debate is about.